Sepsis is characterized by life-threatening organ dysfunction caused by a dysregulated host response to infection. Cellular injury and subsequent organ dysfunction is complex and likely from a combination of tissue ischemia, cytopathic injury from pro-inflammatory mediators, altered apoptosis, and mitochondrial dysfunction and poor oxygen utilization. Sepsis 3 guidelines require that both the presence of infection and organ dysfunction as measured by the Sequential Organ Failure Assessment or SOFA score. A SOFA increase of 2 or greater is indicative of sepsis. A quick SOFA score can be used to clinically screen patients concerning for sepsis. Septic shock is present when there is persistent hypotension requiring vasopressor support to maintain a MAP of 65 in the setting of an elevated lactate despite adequate volume resuscitation. Patients should be cultured with early administration of broad-spectrum antibiotics within 1 hour of sepsis recognition. Hemodynamic parameters are helpful in identifying septic shock. Cardiac index may be initially elevated but decreases with progressive multi-organ failure. Systemic vascular resistance is decreased as well as markers of intravascular volume, and a deficit in oxygen utilization is evidenced by an elevated mixed venous O2. Upper thoracic and cervical spine injuries can result in neurogenic shock due to the loss of sympathetic tone. A loss of sympathetic outflow at or above the level of T6 leads to unopposed vagatonia with associated bradycardia, vasodilatation, and hypotension. Warm extremities is a characteristic exam finding due to pooling of blood in the periphery and subsequent diminished preload. Treatment is intravenous fluid for volume repletion and vasopressor support with norepinephrine, providing inotropic, chronotropic, and vasoconstrictive properties to maintain spinal and distal perfusion. Anaphylaxis is an acute, life-threatening multisystem shock caused by sudden release of mast cell mediators into systemic circulation. Signs and symptoms can include skin and mucosal involvement, including hives, itching or flushing, perioral swelling and angioedema, respiratory symptoms including stridor, dyspnea, wheezing, and coughing, GI symptoms including nausea, vomiting, and diarrhea, and cardiovascular collapse including hypotension. The most important step in treatment is prompt administration of intramuscular epinephrine.